really fun to be able to look at my schedule and see a couple of kids, a couple of teenagers, a couple of adults, a couple of older people, and my schedule every day is very fun and interesting, and it's one of the main reasons I went into family medicine. I actually had several of the injuries that we treat, so I also have somewhat of an insight onto what the athletes are going through when they get injured, and what the rehab process is like, and how fun it is to get back out there and play again. There are a few types of patients that you get to be closer with than the moms that we work with all during their pregnancy, because we get to see them multiple times and going through, of course, many different kinds of emotions, from finding out they're pregnant to if there's any problems during the pregnancy, the joy of finding out the gender of the baby, and then, of course, the challenges of actual labor and delivery, and then the fun after meeting the baby, and to really kind of become part of their family over time. It's a real pleasure to be able to be part of that. What's the most fun about taking care of patients who've been sidelined by an injury is just really working closely with them to see where exactly they're going with their rehab, what we can do to tailor it right to what they need, and to find ways to get them back out on the field or on the court or on the ice to get back and participating. I've had a lot of the injuries that some of these athletes have had, and so I have some idea of what it's like to rehab through them, so it's fun to be able to be part of that process. I joined PVHC right when I finished my residency, which I also did at the hospital in Pomona Valley. So that was in 2007, and I've been partnered with PVHC since then. What sets PVHC apart from other medical centers is our team-based approach. And we really work hard from the front desk all the way to the back office and the physicians to do everything we can to work together to take the best care of the patient possible. Yeah, the most rewarding thing about working with patients is the relationships that we develop with the patients over time. This is another thing that really drove me into family medicine, is what's called continuity of care, where you get to see patients over time. Patients come in and we usually spend a couple of minutes catching up on things that have happened in life. Did they get a new dog, or what's happened with the new baby or their new car or something like that. And then we get to spend time delving into their medical problems. One of the very exciting things that I've been focusing on in my practice in the last year is more preventative medicine. Not only the typical things like cancer screening, but really deep dives into patients' heart attack and stroke risk, trying to help people understand, are there some changes they can make in their diet, as well as medications, exercise, and these other things that we do to try to help reduce their risk of disease, maybe even 20, 30 years down the road.